So I think what the data from PRISM really highlight is that we probably still don't know the best way to deliver these two drugs in combination. And certainly the data suggests that it's possible that we might be able to uncouple the toxicity from the efficacy of the drug, so improve tolerability whilst maintaining treatment efficacy. Now, clearly, this was a randomized phase 2 study. We can't formally compare the two arms. So I think at present, this should not change clinical practice in the sense that 3-weekly dosing should remain the standard of care. But certainly, I think it should hopefully give clinicians confidence around giving delays to the dosing of the Ipilimumab if needed. I think there are other questions, though, clearly out there that remain unanswered, particularly around the number of doses of Ipi that are needed. Do we really need to give 4 doses? And I think many of us tend to, if patients are particularly struggling, then to not necessarily give that 3rd or 4th dose. But there are equally other questions that are out there in terms of even in the maintenance phase. Do we need to give the nivolumab component, for instance, every 4 weeks, which would have potentially wider implications in terms of the financial toxicity of these drugs and the impact on treatment units. And ultimately, of course, the question around how long we need to keep going with these sorts of treatments. But so overall, I think that what the data do, though, is bring to the front this whole question around can we deliver these drugs better and do the minimum amount of harm.